www.healthcmi.com. Acupuncture Continuing Education Online. Today, acupuncture reverts heart arrhythmias to normal. University of Minnesota researchers find acupuncture effective for the treatment of cardiac arrhythmias. In a meta-analysis of 8 independent investigations, acupuncture had an 87 to 100% success rate for converting patients to a normal sinus rhythm after acupuncture. Based on the findings, the University of Minnesota researchers recommend additional studies, including those with long-term follow-up examinations to confirm the results. So this applies to people with atrial fibrillation, ventricular premature heartbeats, and other problems where the heartbeat is irregular. So there's a long history in Chinese medicine going back many, many, many years. So over 1,000 years of treating heart arrhythmias. It turns out that the points tested in this study and other studies, those acupoints are very similar. So we'll see acupuncture points like PC6 Neiguan being one of the most important acupuncture points. It's located on the wrist area. It's actually approximately 2 cm or 2 inches proximal to the wrist. We will also sometimes, and we didn't see that in much of the research, combine that with P7, which is actually on the wrist, dead center on the anterior wrist line. Of course, another one in the wrist area, Heart 7, Shen Men, and CV17, Danjiang, which is on the chest. Those are also well-tested and proven points. And also Bladder 15, Shinshu on the back, the heart base shoe or back shoe point as it's called, is also a tested and proven point. Other points in other studies not covered here, including Sushen Sung, An Mian, Yin Tang, Ear Shen Men, Liver 3, etc., have also been shown effective, but here we're specifically looking at things like PC6 Neiguan, Heart 7, CV17, and the like. This article I'm quoting here at healthcmi.com was published June 9, 2017, entitled Acupuncture Reverts Heart Arrhythmias to Normal. So if you go to healthcmi.com, click on News, and this is the article entitled Acupuncture Reverts Heart Arrhythmias to Normal. So everything's footnoted here. There's more there. For example, Beijing University researchers produced similar findings. They concluded that, quote, conventional acupuncture may be a useful and safe alternative or additive approach to anti-arrhythmia drugs for cardiac arrhythmia, especially ventricular premature heartbeat and atrial fibrillation patients, which mainly based on the pooled estimate and result from one study with a higher methodological quality. The Beijing University researchers note that additional studies are required to confirm the results in order to produce a more robust conclusion. And it goes on with additional research in this article. Everything, again, is footnoted. It gets very specific about how acupuncture works. There's even mention of a laboratory study which definitively shows that acupuncture actually not only can revert and get the heart out of a cardiac arrhythmia into a normal rhythm, but it can also prevent cardiac arrhythmias long term. And in addition to preventing it, we find in laboratory studies that acupuncture literally helps protect the heart tissue itself. And that's verified through electrocardiograms, histological examinations, and ultrastructure analyses. So really fascinating stuff. So important. We're talking about saving lives here and making life better too, because people in AFib, for example, are exhausted. They don't feel well, but more than that, preventing clotting problems leading to stroke and heart attack. So this is incredibly invaluable to these people. Take a look at the article, Acupuncture Reverts Heart Arrhythmias to Normal at healthcmi.com. And thank you for listening. www.healthcmi.com.